This show is brought to you by the Chiropractic Broadcast Network. Check us out on the web at chiropracticbroadcastnetwork.com.
And hello, everybody. Welcome to this edition of Tuning into Health. This is episode number 165, and we're changing our format a little bit, folks. We're going to change the format. We're going to have shorter, more shows. So I'm going to update you several times throughout the week. In the morning, I'm going to get up really early in the morning, pour over some of the healthcare news that I think you can use. And, yeah, you can have some fun with it as well. So, hey, we've got the Super Bowl over with, finally. I watched the last minute of it and couldn't believe that I saw a man back into the end zone. Anyway, hey, we got Fury at vaccine scandal. This one's a hot one, folks. U.S. adult vaccination level is low, they say. Of course it is. Even pediatricians want suicide warnings placed on ADHD drugs. And this, women, cocoa from dark chocolate lowers risk of colon cancer. Oh, Carolyn Lovell, a home birth advocate, dies giving birth. What are the risks? You know what? Women die in hospitals, too. Expert healthcare mandate is constitutional. Well, we'll describe that a little bit. And how doctors do harm. That's an article from CNN that was out there just recently. So, yeah, we're just going to do a shorter version of the show. Get all the highlights. Give you something a little, you can look over at your coffee in the morning and be aware of, so you can talk to different people about all these healthcare issues. We'll be back right after this. And welcome again, everybody, to this edition of Tuning into Health. Again, my name is Dr. Chad Rohlfsen, right here from Des Moines, Iowa, from the Spinal Tuning Studios. Right here in Des Moines, Iowa, yeah. Hey, we got a little neat little show for you today. It's going to be an abbreviated show. We're going to talk about, how do doctors do harm? There's an article in CNN. And Otis Brawley says he's amazed by the number of healthcare professionals who seemingly reject the scientific method. That's interesting, because most of them hide behind it. The story starts off like this. Helen, 50, was college-educated, married, worked at a middle management at a financial services company, had good health insurance. I don't call it health insurance anymore, folks. She was diagnosed with early-stage breast cancer in 1990. She saw doctors with some of the best reputations. After appropriate surgery, she was given high doses of chemotherapy with bone marrow transplant. The treatment almost killed her several times and was hospitalized for nearly a year. In this book, How We Do Harm, co-authored by Paul Goldberg, describes the challenge of some ordinary Americans experiencing while they're trying to get quality health care. In the book, it shows examples, real-life examples of the nameless faces that we talk. You've heard me talk several times that, the medical studies, the actual published peer-reviewed medical studies that talk about the amount of deaths that happen per year from just prescribed medications. And that would be like 198,815, according to the November issue of the Archives in Terminal Medicine. Now, that number has jumped up to 218,000. That's people dying per year. That's more than 3 jumbo jets crashing every day. Not to mention how many people, it puts 8 million people in hospitals. Puts 8 million people just from properly prescribed medications and whatnot. So most people take that stuff and they pop it in their mouth just like it's candy, and they think it's healthy for them, and it's not healthy for them. It's trying to cover up one symptom by trading off other symptoms. So, and if you want to make that trade-off, then, well, that's your free right. You go ahead. You go right ahead. However, maybe healthcare choice isn't your choice after all. Yeah, here's an article from UPI.com from New Haven, Connecticut. It says, when people cannot afford healthcare, billions of uncompensated healthcare dollars are shifted to private insurers who pass on the cost to U.S. research. A U.S. researcher said. That's why you get a $75 Band-Aid from the hospital, right? Jennifer Prague-Ruger, an associate professor at Yale University at the Public Schools of Health, says in her book, Health and Social Justice, an important perspective in lacking healthcare reform debate is the ethical underpinnings of the healthcare system and health policy. Affordable healthcare requires the non-exempt taxpayers purchase a minimum level of health insurance or pay a penalty. But this healthcare mandate has been challenged in the U.S. District Court and U.S. Circuit of Court of Appeals. So, and it really isn't it up to the Supreme Court, to tell you the truth. In a brief for petitioners, U.S. Supreme Court and the U.S. Department of Health and Human Services say the individual mandate is legitimate use of Congress's commerce and taxing powers because healthcare markets have near universal participation and minimum coverage provisions is needed to regulate the way individuals pay for their participation. The federal brief cites the Ruger's article, which she argued the health risks are uncertain timing, magnitude, and frequency, making it difficult to predict healthcare services will need to be and how much the cover will be necessary. So she's trying to argue that the whole Obamacare thing is constitutional, which you can't mandate people buy something. Okay, then if you can do that, use Obama's own words. Then you can mandate that everybody buy a home, so there'll be no homeless people. It's ridiculous, and they're using healthcare they're using the term healthcare wrong because the type of care that I am okay with on a universal scale is crisis and emergency care. But health care is up to the individual. It's totally up to the individual. And just because you visit a hospital doesn't mean that's health care. It's emergency crisis care. So basically the practice of medicine is crisis, trauma, emergency care, and that's about it. But trying to regulate people's health care is like herding a bunch of cats. It's never going to happen. It will never happen. I'll have that article posted on Facebook.com/Rohlfsen, so if you want to check it out. Okay, here, this is what they were waiting for. A home birth advocate dies giving birth. So what are the risks? A private midwife-assisted Lovell with her delivery. Lovell's death was sparked by the debate of the risks of home birth. The spokeswoman for midwives in private practice told Herald Sun it was very, very rare, and it was impossible to imagine what might have happened. The spokesman said it was the first time in her 15 years working as a midwife that she heard of a maternal death following a home birth. According to the Sydney Herald, Morning Herald, Lovell had written in 2009 the inquiry into health legislation amendment, so midwives and nurse practitioners bill, that she is quite shocked and ashamed that home births will no longer be a woman's free choice in low-risk pregnancies. Now, the only reason that this is out, basically, is because home births are becoming more popular. And it's like the opponents to home birth want everybody to believe that a hospital birth is safe, just as safe, which if you look at the rates, comparing the two, it's unbelievably safe compared to a hospital birth. Not to say it doesn't have risks, because it does. This woman died from a heart failure, heart problem, okay? So a cardiac arrest. So, and then they're trying to pin the whole home birth thing as being, dangerous and whatnot. And with the media's help, they can, make quite a headway, and take back the home birthing, industry back. quite a bit. And hospitals would love nothing more than that because they want to control it and they want to charge the crap out of you for having a baby and yeah, it's bad. All right. Cocoa from dark chocolate lowers risk of colon cancer. Not only is it good for your heart, folks, I guess it's good for your colon too. Colon cancer is the third leading cause of cancer deaths annually, and statistics that remain consistent despite the increased awareness of the deadly disease. Researchers from the Science and Technology Institute of Food and Nutrition in Spain have published the result of a study in the Medical Molecular Nutrition and Food Research detailing the potent anti-carcinogenic effect of natural chocolate compounds. Cocoa. Scientists determined the first time that the regular consumption of cocoa negates an inflammatory effect of the digestive oxidative stress that results in intestinal complaints and a precursor to the genesis of colon cancer. So, not only is it good for your heart, it's good for pooping too. That's a good thing. Even pediatricians want suicide warnings placed on ADHD drugs. What? Wow. This comes from naturalnews.com. I'll have these posted on Facebook later on. But both ADHD diagnosis and treatment with mild altering psychiatric drugs have been frequently contested topics. Much of the vague criteria for a diagnosis is highly subjective, as many symptoms associated with the disorder are obvious consequences of forcing young children inundated with fast-paced entertainment to sit still in a boring classroom. Equally, many other causes linked to the condition, food dyes, sodium benzoate, for instance, and the major dietary culprits, are excluded from the conventional discussions of the disorder. Like many psychiatric conditions, ADHD has been medicalized with treatments centering around the drugs of dubious safety and efficacy. The diagnosis of ADHD doesn't have any objective diagnosis, by the way, which kind of throws science out the window. Diagnosis of ADHD has skyrocketed in recent years. It's been skyrocketing for the past 25 years, with 3 to 5% of the global population now carrying the label. Harsh class of psychiatric drugs has turned fellows into address this epidemic. So Ritalin, for instance, is an amphetamine shown to be more potent than pharmacological cousin cocaine. It's prescribed to roughly 75% those diagnosed with ADHD. Ritalin and cocaine are not that far apart in the molecular scale, folks, and they're classified in the same class 2 narcotics. Not a good thing. The U.S. accounts for 86% of the global consumption of Ritalin. It's sad. It's really sad. Hey, have you remember that that video that's out there that talks about the crystalline structure of water? Well, there's another video out there when it comes to thought and whatnot. Do you think that water imprints what it comes in contact with? Like, do you think water has memory? Well, that might be coming here. I got a little video I'd like to show you. It's not very long, but it's really, really kind of interesting. So water imprints what it comes in contact with.
To what extent is water capable of picking up information? What does it perceive? And how does it remember it over time?
The Aerospace Institute in Stuttgart has discovered a relatively simple way of making the structure of a drop of water visible. The researchers have had their efforts rewarded by insights into a very beautiful world. Each drop has a face of its own, unmistakable and unique. Why are the individual drops so different from one another? We got a lot of people to come to a lecture hall here at the Institute, gave them all the same water, had them make drops at exactly the same time, collected all the drops, and then discovered that each individual produced different images from the same water. And here you can see the results. There on the right you can see that the images of the individual students are different, but those made by a given student are all quite similar. This is the work of the first experimenter, this one here from the second, this from the third, and this from the fourth. Individually, they can quite easily be reproduced, but you would never have thought that they were all from the same water, because when you compare the images from the different people, you see some big differences. Then we undertook experiments to find out whether things changed when we put something into the water. A real flower was placed in the water. A while later, we took a drop of water, and here you can see one of the pictures. And you can see it in this picture. It's the typical image you get when you put a flower into water. You could recognize the flower in every single drop in this glass, of course. That can be reproduced and has significance. And if you were to put a different flower in here, for example, a Sweet William flower, then all the drops of this water would look like Sweet William.
I don't know about you, but this is pretty cool.
The statement that water has a memory practically changes our whole way of looking at the world, of course. Let's travel down the Rhine in the figurative sense. The water is flowing down the Rhine, picking up information everywhere it goes. So the water has more information at the mouth of the Rhine than it had at the source. And the Dutch, living at the mouth, when they drink that water, they're also drinking all that information. Thus, the world's oceans would no longer be something that separates us, but instead a giant storehouse of information, and the rain would perhaps be a data medium carrying information to the world.
Wow. I think that's very cool, and I don't know what type of implications that could have on the world. And, you know, I don't know if I'm going to see it at the next psychic fair. Because, you could, test the water. So it's kind of interesting. So anyway, hey, we got a couple more stories talking about adult vaccination levels are low and they're putting children at risks. Well, you know what? It's been happening for a long time. Adult vaccination levels are dismal, and they always have been dismal. And you know what? No outbreaks of any mass scale have ever taken place. So, anyway. Approximately 45,000 adults die annually from the vaccine-preventable diseases, while adult vaccination coverage remains low, researchers said. The report published in the Centers for Disease Control and Prevention of Morbidity and Mortality weekly report set apart from the influenza vaccination. Recommended for all adults, adult vaccines target different populations based on age. There are certain medical conditions, behavioral risks, such as factors of injecting drugs. It's basically propaganda for why adults should be vaccinated. And you know what? Hey, what if you refuse under the new Obamacare? Well, if you refuse to get a vaccination under Obamacare, what? If you refuse to get your kids vaccinated, what can they do? That's a great concern. That's a great concern. But hey, it doesn't matter because you know what? The government will screw you anyway because fury at vaccine scandals. Up to 200 doctors, nurses, firefighters, prison officials, police officers, forensic scientists, and binmen, I don't know what a binman is, say that they have developed serious physical and mental health problems after injections essential for their work over the past 10 years. All have given up their jobs, and some are now 60% disabled. Last night, it emerged that they are to miss out on payouts, prompting furor among campaigners. More than 150 MPs have lent their support to demands for better deal of the victims. Well, I thought vaccines were entirely safe, right? No, there's a lot of adults getting injured as well, and now the government's just dumping them because they're inconvenient. Olivia Price, a vaccine victim support group, said these people have given their lives for service of looking after others, and it's how they get repaid. They've lost their careers and they're burdened to their families, and it's become very degrading. Frontline health workers, social workers, prison officers, and binmen. I still don't know what binmen is. This might be down in Australia. Have vaccinated against hepatitis B as a condition for their employment. This is to protect them from contracting potentially fatal conditions from the infected blood through needles and injuries and other physical assaults. Although they are not legally forced to have the vaccinations, without them, they are not allowed to work. So they're forced to have the vaccinations legally. Experts believe the injections cause their health problems, which include chronic fatigue, muscle pain, weakness, cognitive problems, because of social or illnesses developed soon after the vaccination. This is what I'm seeing in a lot of the people in the military that come into the office. And it used to, now it's known as PTSD. Now it used to be known as Gulf War Syndrome. And it's people that, you know, they work in supply and somehow they have PTSD, you know, and that's battle fatigue, it's battle stress, blah, blah, blah. But they worked in a supply room and they have, you know, they weren't under any duress or direct fire, but somehow they get diagnosed with PTSD. All it is, folks, it's the new Gulf War Syndrome, and it's caused by vaccination. Same thing these people are having as well. So, you know, people's memory are short when it comes to this, because Gulf War Syndrome, it's the same set of problems, but people forget. So, you know, hey, better have people out like you that will call PTSD what it actually is, and it's another Gulf War Syndrome. And it's most likely due, I can't prove this because they're very slippery on it, but it's most likely due to vaccine injury. That's what it is. Makes the most sense. People felt like crap after their vaccination days as well, and they're shot up with a whole bunch of stuff. So anyway, hey, how do you protect yourself from stress? What happens when you plug 10 appliances into an outlet and turn them all on at the same time? You blow a circuit. The same thing can happen when you surge an unprotected nervous system with stress. Picture your nervous system as an electrical outlet with multiple stressors plugged in. Turn them all on at the same time and pow! You've overloaded the system, fry a circuit, and ruin a good state of health. Chiropractors call this a subluxation. Depending on what nerve circuits are blown, you can experience symptoms from minor aches and pains to more significant health problems like high blood pressure. Although it's important, I was just going to read the reference from that, Journal of Human Hypertension. Although it's impossible to turn off all the stress in your life, you can guard against unsuspected surges with regular chiropractic care. That means chiropractic care when you're not in pain. It means chiropractic to help maintain and help, well, I hate the word maintenance because you don't want to stay in the same spot, right? You want to go up above. Chiropractors perform their job like surge protectors, skillfully monitoring your nervous system for overloads and adjusting circuits back into normal when necessary. It comes to fighting stress and dis-ease, which means imbalance. Nothing beats keeping your power on with chiropractic. That is from the weekly Sticky, and very, very neat service. So I'll be sure to share and tweet that as well. But how to surge protect yourself from stress makes sense to me. Hey, by the way, if you are in the Des Moines area, if you need a chiropractor, the Spinal Tuning Center right here in Des Moines, Iowa, can help you out. We're just off the interstate, I-3580 on Merle Hay Road, an easy, convenient location. And we're going to be moving offices just downstairs here in a little bit. So, yep, I'm going to have a brand new Spinal Tuning Studios to broadcast out of. These broadcasts are going to be happening Monday through Thursday. Hopefully in the morning I'll get them out, and then I'll transfer them to YouTube and Blip and live stream. And, well, hopefully the relevant information is there for you. Hey, I tell you what, we still have some people that we really like to promote. And one of the people that we really like to promote just won Best Natural Skincare Products in America from the Taste Awards. And they even went to Hollywood. They're from Huxley, Iowa. Jenny and Isaac Drew, and they own Genuinely Pure. So, well, they're wonderful people, and we love to promote their products.
Do you have itchy, dry skin? Struggling with acne, eczema, asthma, or other health problems? Or maybe you're just looking for a safer, natural alternative to cleaning and skincare products. Maybe it's finally time for you to make the switch. What do I mean? A vast majority of skincare and cleaning products today contain toxic synthetic ingredients that are having a devastating effect on our health and our skin. But there is a better way. At Genuinely Pure, it's our mission to provide 100% natural and safe products that you'll absolutely love, and provide them at affordable prices. We offer a full line of products for the body, face, home, and baby, all full of pure plant-based organic ingredients to nourish, heal, and rejuvenate your skin. So now are you ready to make the switch? Come check us out on the web at genuinelypure.com. Find us on Facebook or follow us on Twitter. Place an online order with the promo code Dr. Chad to save 10% off your purchase. Make the switch to Genuinely Pure today.
Use that promo code, folks. It really works, and it will save you probably some shipping costs.
And you are tuning into Health with Dr. Chad.
Well, that's it, folks. Thank you so much for tuning in. And we'll try to keep you informed a little bit more throughout the week. How's that? I think that's a good trade-off. So we can just kind of concentrate on some of the more potent healthcare stories. And if we have interviews, we can always go over. So I'm not going to worry about time formats or anything. But otherwise, I want you just to have a great one. Hey, by the way, the lead-in and the ending music, the bumper music, is from Don Ross's album, Breakfast for Dogs. Available on iTunes. I love his music. Acoustic guitar, amazing. I'll get some of the other. This is called Crazy. A lot of people think I'm crazy for doing this and having the opinions I do, but as long as I can back up the opinions, folks, that's all that matters, right? Anyway, hey, have a great day, and we'll see you tomorrow.